Dry, flaky skin. When the skin loses moisture or its natural oils, leading to roughness, irritation, and sometimes peeling. This skin condition can range from mild to severe and may result from various causes, including environmental factors, underlying health issues, and personal habits. Let's discuss everything about today's topic, which is divided into three chapters. Chapter 1: What is dry, flaky skin? Dry, flaky skin is a condition where the skin loses its natural moisture or oils, leading to rough, scaly. It can occur anywhere on the body but is most common on areas like face, hands, legs, and arms. Dry, flaky skin appears to be flakes or scales, small, thin pieces of skin that peels off, often white or light in color. Rough texture. The skin may feel uneven, bumpy, or coarse to touch. Cracks or fissures. Severe dryness can cause the skin to crack, sometimes leading to painful fissures. Dry patches may appear red or inflamed, especially if irritated or scratched. Dull skin. The skin often looks lifeless or ashy, particularly on dark skin tones. Larger scales or thickened patches may develop in chronic or severe cases. In our second chapter, we will know what are the causes of dry, flaky skin. Cold, dry weather. Low humidity levels in winter can strip moisture from the skin. Excessive sun exposure. UV rays damage the skin, leading to dryness and flakiness. Wind exposure. Wind can dehydrate and irritate the skin. Point number 2 is lifestyle. Frequent washing or long hot showers can strip the skin of its natural moistures. The oils, harsh soaps and cleansers, products with strong chemicals or fragrances can irritate and dry out the skin. Lack of moisturizing. Failing to use moisturizer, especially after washing, can exacerbate dryness. Dehydration. Not drinking enough water can lead to less hydrated skin. Number 3 is skin conditions. Eczema, a chronic condition causing dry, itchy, and inflamed skin. Psoriasis, a skin disorder characterized by red patches covered with thick silvery scales. Seborrheic dermatitis causes flaky scales, particularly on scalp, eyebrows, and sides of the nose. Ichthyosis, a genetic condition leading to thick and scaly skin. Fourth will be medical conditions. Hypothyroidism, an underactive thyroid can slow skin renewal, leading to dryness. Diabetes, high blood sugar levels can lead to skin dehydration. Nutritional deficiencies, lack of essential fatty acids, vitamin D or zinc can contribute to dry skin. Next is medications. Certain medications such as retinoids, topical or oral, acne treatments like benzoyl peroxide, chemotherapy drugs. Aging, as you age, your skin produces less oil, making it more prone to dryness and flakiness. Allergies and irritants, contact with allergens or irritants like detergents, fragrances, or certain fabrics can dry out the skin. Frequent exfoliation, overusing scrubs or exfoliating products can damage the skin barrier, causing dryness. That brings us to chapter 3: How to prevent dry, flaky skin. But before moving ahead, let's know how it actually feels when you have dry, flaky skin, how you know you're dealing with dry, flaky skin. Number 1, tightness. The skin may feel tight, especially after washing or exposure to cold weather. Itchiness, dryness often causes itching, which can range from mild to severe. Irritation, skin may sting or burn, particularly if exposed to harsh products or scratching. Sensitivity, affected areas may be more sensitive to touch or environmental factors like wind and heat. Common areas are face. Flaky patches often appear around the nose, cheeks, and forehead. Hands, dryness is common on the knuckles and fingertips. Legs and arms, shins, and elbows are prone to dryness due to thinner skin. Scalp may appear as dandruff or flaky, dry skin along the hairline. Preventing dry, flaky skin involves maintaining the skin's natural moisture barrier, avoiding irritants, and protecting the skin from environmental factors. To overcome dry, flaky skin, moisturize regularly. Use a fragrance-free, hypoallergenic moisturizer immediately after bathing. Opt for products containing hyaluronic acids, retains water in the skin. Glycerin attracts and retains moisture. Shea butter provides deep hydration. Avoid hot showers. Use lukewarm water instead of hot, as hot water strips natural oils from the skin. Limit showers or bath for 5 to 10 minutes. Use gentle cleansers. Choose mild, soap-free and fragrance-free. Avoid products with alcohol, fragrances, or harsh chemicals. Exfoliate gently. Use a gentle exfoliant like a chemical exfoliant with lactic acid or salicylic acid once or twice a week to remove the dead skin cells. Avoid over-exfoliating, which can worsen dryness. Protect your skin during cold weather. Wear gloves and scarves to shield skin from wind and cold air. Use a humidifier indoors to maintain moisture in the air. In the sun, apply a broad spectrum sunscreen with SPF 30 or higher daily to prevent sun damage. Stay hydrated. Drink plenty of water throughout the day to keep your skin hydrated from inside. Eat water-rich foods like cucumber, watermelon, and oranges. Choose the right fabrics. Wear soft, breathable fabrics like cotton. Avoid wool or synthetic materials that can irritate the skin. Avoid harsh products. Stay away from skincare products containing alcohol, retinoids, unless prescribed by a dermatologist. Use hypoallergenic products designed for sensitive skin. Maintain a healthy diet. Include food rich in omega-3 fatty acids found in salmon, flaxseeds, and walnuts. Vitamin E found in almonds, sunflower seeds, and spinach. Vitamin C found in bell peppers, strawberries, and broccoli. Manage underlying conditions. If you have eczema, psoriasis, or other skin conditions, follow your dermatologist's treatment plan. For medical conditions like hypothyroidism or diabetes, proper management can improve skin health, and our last chapter talks about the eating habits that will help you get rid of dry, flaky skin. Eating a balanced diet rich in nutrients that support the skin health can help reduce dry, flaky skin. Focus on foods that promote hydration, strengthen the skin barrier, and reduce inflammation. Foods rich in healthy fats such as omega-3 fatty acids, which helps maintain the skin's lipid barrier and retain moisture, such as fatty fish, flax seeds, chia seeds, walnuts, and soybean. Monosaturated fats that nourishes the skin and moisturize the skin include avocado, olive oil, and almonds in your diet. Vitamin E rich foods like almonds, sunflower seeds, hazelnuts, spinach, and broccoli protects the skin from oxidative damage and supports its natural barrier. Vitamin C rich foods such as oranges, strawberries, kiwi, bell peppers, and kale. These foods promote the collagen production and skin repair. Foods high in zinc, pumpkin seeds, chickpeas, lentils, oysters, and cashews help skin healing and reduces dryness and inflammation. Vitamin A rich foods that maintain skin health and prevents dryness will be carrots, sweet potatoes, spinach, kale, and red bell peppers. Foods high in antioxidants fights free radicals that can damage skin and lead to dryness include blueberries, raspberries, dark chocolate, 90% cocoa or higher, and green tea. Hydrating foods such as cucumber, watermelon, celery, oranges, and tomatoes helps boost your body's hydration levels. Selenium-rich foods like Brazil nuts, eggs, tuna protects the skin from sun damage and supports the skin's elasticity. Next is extremely important, that is probiotic foods, which improves gut health, helps in skin hydration and inflammation. Yogurt with live culture and kefir and miso. Biotin rich foods, eggs, almonds, spinach, and sweet potatoes. Biotin, vitamin B7 is essential for healthy skin, hair, and nails. Time for some bonus tips. Drink plenty of water, 8 to 10 glasses per day to keep your skin hydrated from inside. You can add cucumber slices, mint leaves to make it interesting. Avoid cold or ice cold water as it dehydrates the skin, more bad for your organs and digestive system. Mint leaves and cucumber keeps your body cool and excellent for digestive system. Careful if you have cold or swollen glands though. Limit sugar and processed foods. High sugar diets can contribute to inflammation, which may worsen the skin condition, and it can lead to dryness and many more issues related to your health and skin. Being mindful of what you choose to put in your body is all it takes to maintain a healthy skin and body. By including these nutrient-rich foods into your diet, you can support the skin health and reduce dryness over time. When do you know it's time to see a doctor? If the symptoms are severe, persistent, or causing significant discomfort, or if there is a cracking or bleeding, it's important to consult a dermatologist for a proper diagnosis and treatment. If dryness and flakiness persist despite home remedies, if it's accompanied by redness, severe itching, swelling, or cracking, signs of infection like pain, pus, or fever. Some last reminders: use gentle fragrance, free cleansers, and moisturizers. Apply moisturizer immediately after bathing. Avoid hot water, opt for lukewarm showers, and in the end, just stay under cold water for 5 to 10 minutes. You can avoid this part during winters, of course. Stay hydrated and eat balanced diet. Protect the skin from cold, windy, or sunny conditions. And that brings us to the end of this video. I thank you all for supporting us. If you love the video, hit like and subscribe to this channel. I appreciate you all. Bye.